Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and today I wanted to do a video showing someone undergo a flexible laryngoscopy. That's a very common procedure that we do in the office to evaluate people with hoarseness or sometimes swallowing complaints or any kind of concern in the lower throat. This is a procedure where we pass a small light through the nose down towards the vocal cords. Patients have many times heard about this procedure or they're very afraid to have it done because they think it's going to be painful. Just wanted to give an example showing how easy this can be and how it's typically something that patients certainly shouldn't be concerned about. It's an excellent tool to allow us to really evaluate the throat and just to be able to do our jobs thoroughly. So, hope this helps. Thank you. All right, so we're going to take a look in Heidi's nose. So I'm going to pass a little light through the nasal passages and look at her vocal cords and see how things look in there. So we're just kind of guiding the scope through the nose, and now I'm in the back of the nose at the nasopharynx. Looks like she's had an adenoidectomy at some point. You can see a little scarring back there. I'm going to advance the scope a little further towards the vocal cords. You doing okay?
Mm-hmm.
Good. Sniff a couple times for me, please. Great. Just say E.
E.
Give me another big E.
E.
So the vocal cords close when she says E. They open up when she takes a breath. Everything looks very well. Don't see anything concerning there at all. Good. One more good long E.
E.
Perfect. Okay. How was it?
That was good.
All right, great.
Yeah.
Thank you.
I didn't bother.
There, see, that wasn't so bad. So now I'm going to go through the video in a little more detail and show you what we see in high definition and just describe some of the findings from this patient's evaluation. Thanks. Here I'm passing the scope through the right nasal passage. The septum is on the right and a structure called the inferior turbinate is on the left. I'm going to advance the scope along the bottom part of the nose, taking care not to make contact with the lining tissues, which would be more uncomfortable if those are touched. As I pass the scope to the back, we can see a structure on the left where the eustachian tube opens, and then we'll see places on the mid to upper right where there's been some scarring from a previous adenoidectomy. I'm now going to advance the scope down past the nasopharynx into what's called the larynx, or the voice box. Here we can see the vocal cords start to move, the vocal cords of the V that's in the center of the screen. There's a little bit of mucus around the outsides. The bottom part of your screen, there's the epiglottis, which is a cartilage piece that's part of our framework to our voice box. This patient has some very mild reflux changes that are seen, but nothing else that's concerning. The vocal cords will come together whenever the patient says E or swallows. Now I'm backing the scope out. And that's all there is to it, a flexible laryngoscopy. Thank you.